So, there are many queries for the abdominal fat. So, we get almost 20-25% of my practice is for the abdominal fat. So, what are the different treatments and how to treat the abdominal fat? So, first of all thing is we have to choose our clients very wisely. So, liposuction is the technique, but it is only for the patients who are already active, the person who is dieting, the person who is doing exercise, but there is still a stubborn fat, suppose in the chest area or in the love handles, in the thighs. So, if there is a stubborn fat, then we can remove it easily with the liposuction. And before the surgical method, we have certain non-surgical methods also, but I am less following these non-surgical methods, though in my clinic there are all the technologies starting from the radio frequency to the ultrasonic and the cool sculpting or the cryolipolysis. We have all these technologies, but these are done by my junior doctors. So, the cosmetologists, they do all these treatments because I know the results are not optimal, because in the patients who directly demand me for the non-surgical methods, they are somehow not convinced to do for a surgical procedure. In those patients also we choose very wisely, because in non-surgical methods the result is not at all promised. We have to be very wise to choose the patient who understands there are multiple sessions, and sometimes even we are afraid that we are not getting the optimal results. But reverse is true for the surgical procedures, that is liposuction. So, lipo is fat suction, we are sucking out the fat, actually it is aspiration of the fat. So, how to aspirate the fat? So, first thing to understand is this fat is very tough in your abdomen. So, we have to melt the fat or emulsify the fat. So, there is a normal liposuction in which we are hitting the cannula inside, but there are advanced liposuction, that is the ultrasonic liposuction, the water jet liposuction, which emulsifies the fat. And we are lucky at Kyra Aesthetic Clinic. I am doing all these technologies for more than 15 years now. We have the Vaser or the ultrasonic liposuction, we have the water jet liposuction, because you have to melt the fat. As a layman, you can understand this is a solid fat, you have to liquefy it and suck it out. So, you need some technology to liquefy the fat, and a driver, a doctor or a person who uses this technology and who is well versed, and I have all the national and international trainings to use these technologies. Second thing to understand is what is the visceral fat. So, this is very important in my consultation. So, if the fat in the abdomen which is pinchable is just below the skin, that is subcutaneous fat, we can remove with the liposuction, but there is a fat which is inside the peritoneum, around the intestines, around the viscera. So, that is the visceral fat. So, there is no technology, no medicine, no treatment, no surgery to remove the visceral fat. So, that is removed only by the diet and by the exercise. So, you will get n number of products, the medicines, the salon treatments, the massaging treatments to remove the fat, but these are all wrong. There is no result from these treatments. So, either you do exercise or you come to me for the liposuction. And visceral fat is never removed by the liposuction, that is the internal fat. So, in the abdomen, so sometimes I get a very fatty patient. So, all my junior doctors, they say, oh, he is a good client for liposuction, but when I open the shirt, so there is no fat which is pinchable, and it is totally internal fat, that is also called a beer belly. So, there is a tough fat which is inside, the visceral fat which cannot be removed. So, I refuse almost 3 to 4 cases every week, I refuse to do liposuction because of the visceral fat. But visceral fat is only in the abdomen. So, in the thighs, in the arms, in the chest, we are not facing this problem of the visceral fat. And second thing to highlight is the experience of the doctor. Believe me, Your doctor is very important, more important than the technology. So don't go after the marketing gimmicks. There is every year there is a new technology, the new machine for the fat removal, but your doctor, the experience of the doctor has to be very important. So I am doing this for more than 15 years now, and I am internationally certified plastic surgeon, and I want to be very genuine and expertise with my clients with which modality will be better for the treatment. Sometimes I refuse for the treatment if my patient is not understanding what are the actual results. The expectations are not realistic. The person, he or she is dreaming more, the more result from the liposuction which I cannot give. So I can refuse the patient. Sometimes they are showing me the pictures I cannot believe he or she can achieve such a result. So we have to refuse the patient. But the patients who are already active, who are dieting, who are exercising, so we can do miracles. We can give the good etching of the abdomen, we can do high definition liposuction, we can give the lateral dips, the midline groove, the etching, we can give a beautiful results if the patient is intelligent and understands, because it is not only the surgery which is important, you have to be on a certain limitations in your diet, and you have to be active in your daily routine. So if you think liposuction is good for you, so we always ask our patient to send us the pictures from front and the side, or if he or she can visit to the clinic, that is better, because I can touch the area and we can show many similar before and after result pictures, and we can explain the better. My junior doctors, they are very good in counseling, then I counsel the patient myself. But my patients, they come from very far off places, from abroad also. So we ask them to send us the pictures, then we assess whether they are good candidates. Assessing is by the pictures and over a telephonic conversation. So I personally talk to my clients to understand their psychology and their expectations, and then we decide for the liposuction procedure. And there is a limitation, because I am never afraid to take out more fat, even more than 6 liters, but I will do only the things which are safe for my clients, because I want to call them in the morning and send them back in the evening, because I have got a very busy practice and it is a daycare procedure. I don't have a setup in which there is a ICU, or in cosmetic surgery or private clinics, we don't do such surgeries. We only prefer the procedures which are daycare. So liposuction up to 3 liters, up to 4 liters is a very safe limit, and I can give you a very good results in just removing 3 to 4 liters. And I always believe in the 360-degree liposuction. So abdomen we divide into upper abdomen, the lower abdomen, then both sides, and the back of the abdomen. So this is called 360-degree liposuction. If your surgeon is not trained for the 360-degree, then the results will not be optimal, because this is the mistake we have been doing 7-8 years back. We were concentrating on the front only. There was very less demand for the back or the waistline definition. But these days we convince our clients, both male and female, that they should go for the 360-degree liposuction. So results have improved over the time, our skills have improved, our hands, our mind has improved. So we are getting very good results. So in liposuction of the abdomen, which is the topic today, we give a very small cuts which is hidden in the umbilicus or in the bikini area. So they are not at all visible, they are just a ½ inch of the cut. From there we introduce some fluid which contains the medicines, the numbing medicines, and we then use the technology. After we inject the fluid, the tumescent fluid, we use the technology, the ultrasonic technology. So that will melt the fat and we can suck it out at a low pressure. So that is very important. Even if after ultrasonic liposuction, if a surgeon is using a high pressure, then again you are causing injury to the internal blood vessels or to the nerve. So we do always at a low pressure and after emulsifying the fat. Then there is a importance of the pressure garment, because your skin should not remain loose. We immediately put the pressure garment on the same day, and that has to be continued for 3 to 4 weeks. Then to highlight, what is the highlight of today's talk is to understand what will happen to your skin. If you suck out 3 liters of fat, your skin might become loose. Sometimes the skin does not retract back. So there is an empty space, there are chances of the seroma formation. So that should be highlighted. For skin tightening, again at Chiroesthetic Clinic, we have the body tight technology, that is by InMode, that is invasive radio frequency skin tightening. So you can ask us for more details, because this is very sought after and a newer technology and US FDA approved, and we were among the first clinics to bring it into this area. So we do the skin tightening. You understand, the fat is harder, we have to use a technology to emulsify, to melt it. Then your skin should not remain loose, so we have to use again a technology for skin tightening. So we do both these procedures together, so liposuction and the skin tightening. So liposuction, not the conventional, we use the ultrasonic liposuction. So now what about the post-operative care after liposuction? In the abdomen, everybody wants the perfect result, so you should stick to the post-operative instructions told to you by your doctor. So first is the medications, only for 1 week, a painkiller, antibiotic, that's all. Just for 1 week you need the medicines. Then the healing time. The healing time should be explained to the patient, because there might be some pain for 7 to 10 days, and healing time is roughly around 2 to 3 weeks, and the best result is at 1.5 months to 2 months. So the skin takes time for the retraction, and you have to wear the pressure garment, and you should be very patient. So you are most welcome. I have told you, which is just to stimulate your mind regarding choosing your liposuction clinic. So I am not telling you to come to us. There are so many other good doctors around you, but choose your doctor wisely. If you want to come to me, then you can WhatsApp us or you can call us, and I am always there to help you. Thank you.